web and mobile-based GIS platform for national-level epidemiology disease control and tracking system presented by G-Century Private Limited. Our team have experience in application development since 2010 and we have won several accelerated awards nationally and globally. The research team comprises with administration partners, technical partners, and knowledge partners. The main objective of this project is to develop common platform to analyze COVID-19, dengue, other communicable diseases and disaster situations for health professionals and the public sector in Sri Lanka. Specific objectives are, communicable diseases reporting system based on web and mobile, review the spatio-temporal characteristics, identify the impacts of natural and man-made factors on spatio-temporal distribution, develop a georeferenced GIS database, cluster-based tracking system incorporate with statistical analysis, spatial analysis, high-risk areas, density with analytical dashboard, get information on the number of cases and other administrative functions. Following are the issues we identifying with our experience. Pandemics have been a challenge all over the world, treatment programs have faced severe setbacks, pandemic preventive systems not effective, due to lack of advanced technological surveillance applications, and enthusiasm to accept new technological initiatives, community-based system failed without making any tangible positive impact due to the inbuilt weaknesses of those systems. Another major reason for failure in epidemic surveillance systems, is that they are operating without the support of georeferenced databases and lack of real-time data reporting mechanism. Lack of trained personnel and accurate maps of patients and breeding locations. Poor lateral thinking. Need attributing to increase the gravity of the surveillance programs, we have conducted research in available web and mobile application to find out the capabilities, technology, and weakness. This window shows the globally mobile application developed for dengue. Most of the application consisting with general information about dengue, learning material, nearest hospital, daily tips, alerts and guides, videos about dengue, calculate body weight and ideal body weight for dengue, but almost all the apps give mistrust to community. Most of the COVID-related apps used Bluetooth technology and QR code technology to facilitate exposure notification system, find close contact, get advice, latest information excreta. Most of the existing COVID and dengue reporting apps are expecting the community to play a key role in providing information to the authorities, but without having a proper community awareness, preparedness, and installation of a foolproof system to filter, store and interpretation of such information. According to the research following are weaknesses of existing systems, not maintaining centralized geodatabase in national level, contact tracing depend on community, complex applications, hard to do investigations, not lawful and proportionate, no sunset clauses, personal information data is not limited to epidemiology purposes and not concerning about data security and anonymity. Possible threat of misplacement, inaccurate recording, duplication of records. PHI who are responsible for upkeeping records tend to fail the duty due to heavy load of work, no real-time risk analysis, no sustainability, and finally digital surveillance would have to address the risk of exacerbating discrimination and marginalization. The current COVID-19, dengue and other pandemics are showing negative effects on human health as well as on social and economic life. It is a critical and challenging task to revive public life while minimizing the risk of infection. We identified gaps. Contact tracing is a key public health intervention for pandemics which is particularly important now, and diseases can be largely prevented by adherence to hygienic principles and protective behaviors. It seems that identifying the processes involved in protective health behaviors can be effective in planning and implementing suitable interventions to encourage the community toward protective behaviors. This is our invective solutions to overcome pandemic situations. System architecture. Centralized cloud hosting servers deployed at ICTA and power with geodatabase, application server, web service, and geocoding engine. Data verification will follow few automation process and manual process and data upload by Director Health Ministry Epidemiology Unit, RDHS, MOH, government and private hospitals. Same time selected health professionals and authorities allowed to access to the web platform via authentication credentials. Mobile application developed to data upload and data view in real time. Overcame a long-term issue prevailed in the country, which was the absence of a centralized database with real-time data sharing model. Uniqueness of the system. Risk analysis, real-time recording, inbuilt research component, dashboard, track and trace the potential infected individuals, contact and cluster tracing, recognize disease trend. Centralized national level database, georeferenced data on spatiotemporal aspects, modern technology to address, direct information to the responsible healthcare workers, risk analysis. User-friendly interface, reliable, systematically collected, coherent data, patient count and upcoming outbreaks, overview the disease spread island-wide. Functionalities and features. Multiple data input approaches, real-time communication layer, GIS domain, spatiotemporal, big data analysis and artificial intelligence, user management with user creation, automation, data-driven, self-learning and support, clustered patient distribution, vaccination profiles. National COVID-19 surveillance system. Base map will provide spatial data distribution, overlay, and visualization of data, patient clustering by category based on pandemic spread bubble. This can be managed manually by giving specific name and color to separated clusters. Daily critical areas by the count of patients reported areas in districts, DSD, GND, MOH, PHI and this will update in real time. Analyze patient dataset with geographic administrative boundary to find risk areas. These risk parameters can be changed according to the health professional's requirements. Overlay GIS layers, hospitals, school, police stations, testing service, and treatment services. This will predict before lockdown and after lockdown COVID situation statically and geographically. Dataset compare, case analysis with boundary, 2 cluster datasets compared with age and gender. Data summarize into geographical boundaries. Proximity analysis. To identify the risk distribution pattern with timeline. Multiple data feed from various sources. Suwapatha mobile application. Social sign-in, multiple language selection, search epidemiology threat, real-time updated, boundary details, nearby hospital details, vaccination registration, epidemiology-related news statistical and charts, emergency contact, real-time push notifications. Dengue surveillance system Western Province. Base map will provide spatial data distribution, overlay, and visualization of data. User can predict the situation by using various statistical charts. Direct link to upload hospitals report dengue patients information. PHI mobile application, display confirmed cases, information about patients, heat map with clusters, high-risk areas, overlay GIS layers, public warning, updating PHI area. In security aspect we used, two-factor authentication, decentralized and work in cloud encrypted SSL, keeping and retrieval, backup, and recovery RESTful web services API abstraction separate database for patient data, user management with user creation, authentication, IP tracing email notification and real-time blocking. User acceptance testing was conducted with Health Ministry, WHO Country Office, PDHS, and Epidemiology Unite Western Province. System launch by Honorable Governor Western Province on October 27, 2020. System demonstration to His Excellency the President on October 30, 2020. System demonstration to WHO Country Office, Digital Transformation Risk Communication Infodemic, supporting accessible, reliable, actionable, and inclusive communication, reopen their economies. Results to be displayed on the official websites. More than 300,000 plus public users use this application in island-wide. Trending #1 mobile application in Sri Lanka. Help the community and authorities to automate vaccination process. 1.5 year working smoothly and destructive testing, users acceptation test conducted. 24/7 monitor the system by COVID-19 Task Force under Epidemiology Unit Western Province. These are the main technology we use to develop this very important application. Standards, we follow. Programming standards. Programming practices. Database standards. Security standards. Play Store rate we achieved 4.1 rating which is good quality app. We always beloved our customers and their valuable views. Social media give due respect to our product. Training and awareness programs conducted to many entities. The same technology and experience we gain can be neutralized in field of GIS-based web and mobile application. There are more opportunities in the disease diagnostics market and healthcare analytics market and it is up to $28.1 billion. Same application can be used to collecting data, processing data, building analysis, solution to acute health issues. A well-established, Accurate epidemiology tracing system is an asset any county. This system can be used around the world in solving spatial problems related to epidemic situation. Thank you very much.